All right. Thank you so much for joining us today, everyone. We are live with our Shut Up or Talk Up wellness lifestyle brand, Health Talk. As you know, we are having a series of conversations with community members. The discussion is about health, and the purpose is to connect wellness and to educate our audience and ourselves on the different aspects of wellness that we have to offer here. And today I have the honor of speaking to Nicha, correct?
Cumberbatch.
And she is the a physician assistant. She's a doula. She's the assistant director of population health with SPORA Health. And so we have the honor of speaking to her so that we can, get some insight and she can give us all the jewels. Thank you so much for joining us
Yeah.
today.
Thank you for having me, Marley. I appreciate it. And again, more kudos to you for taking the initiative to do something like this for our community. Thank you.
Yes, well, thank you as well for participating. Kind of tap into your position as a physician assistant, role you play, and some of the challenges you may see within the community or in that immediate role.
Yeah, so, being a physician, we're advanced practice providers. So, and some people may call us mid-level providers. So we prescribe, we diagnose, we're in the office. I would say 98% of the time we are flying on our own, seeing everybody that is out there to be seen, insured, uninsured, and in different scopes of practice. I've worked in emergency care, of course, women's health, psychiatric care, primary care, orthopedics. So the one thing that is, I would say, consistent throughout all of those areas of medicine is one, I'm passionate about my life's purpose and the role, which is I'm a healer. I'm a healer, I know it, and this is one avenue to be able to do that. But the other thing that is also pretty consistent is that oftentimes in any of those areas of medicine, I may have been the only Black or the only Black female. Right? Healthcare disparities and inequities are very prevalent throughout the United States. And specifically in the current area of medicine that I work in OBGYN, we represent mostly the smallest percent of across all the areas of medicine. And that includes doctors, and it's even smaller for PAs and other advanced care providers like nurse practitioners. So these are some of the things that when you talk about having patient-provider concordance and an ability to see someone that looks like you and culturally understand some of the nuances that it's hard for you to explain because it's who you are, it's culture, it's the way the family's done it. Having that kind of I see you really does make a big change and an outcome on their own outcomes, as far as sometimes they're just compliance to be willing to listen to you talk about how they can change their diet. Right. Sometimes, the branded majority of the information out there is like, yeah, you need to change your diet, build sometimes in values and importance on even certain foods. So it's like telling Caribbean people, stop all the rice.
Right.
You never like, you have to compromise, and you have to be able to know how to make those compromises with them and talk about, changing out the rice for brown rice because it has a little bit more fiber and vitamins, and the vitamins has never been on from a patient level in the experience of me being qualified and really good at what I do in any area of medicine that I've worked at, because I'm really passionate about it. But oddly enough, sometimes it is that, which I've experienced, which I'm not sure if it's just because I'm a female or a Black female, or combination of both. Many people will definitely doubt your or supervisors. And it's almost as a test to, do you deserve to be at this table? Do you deserve to sit here among the rest? And you feel like you're kind of constantly proving. You have to almost go above and beyond. And when I think about that, it shouldn't be the plight of anybody. Your results should show. And when they show, but you still have to double down and go harder.
And to go harder.
It can be one of the challenges, but I've also learned to, I've learned to use that challenge as a fuel to just reconfirm what passion looks like.
Yeah.
Several, I mean, this is one of them.
You mentioned the disparities, and I see that it's 2022. The world is shifting, things are happening, feathers are being ruffled. The title of our wellness lifestyle brand is called Shut Up or Talk Up. And one of the reasons why we have that call to action name, because there are topics that we're either going to shut up about it or we're going to talk up about it. And it's a part of wellness, and it's a part of how we're growing disparities within certain communities as a Black woman, and as just a woman, and just as a human, and all the other layers that comes with me as an individual. I have experienced that, whether it's professionally, whether it's within healthcare. I have communicated with women that are parents and have experienced that in the process of even childbirth, different disparities, and because of the color of their skin, or because they're a female.
Yeah.
What are some things that you can share with women that are going through that within the healthcare, whether they are the professional that is helping the community, or if they are the patient and they feel like they're constantly experiencing that block of not really getting enough treatment or being underestimated because.
Yeah, I mean, one thing that's, I think, very interesting, and everybody should really become more aware of this, and it's one of the most alarming statistics to me. So Black women in general have a higher rate of pregnancy-related death, okay, compared to white women. And when we talk about that, that's at large. And then when you really deeper with those numbers, Black degrees above average income are still 1.6 times higher to than a white woman with a high school diploma. To me, that really speaks to, okay, so the disparity is not just based on class. It's not about resources. It's not about how much education that's going to be the difference. It's built in within the system of systemic racism. Right. And how those numbers then trickle out. So my advice to clinicians who are both culturally aware and the ones who are not, continue to build that patient-provider trust by listening. Every mother's wish could be something the world is about to crumble, where spotting can be like a normal part of pregnancy. And so being dismissed about that is not the right approach, because you really haven't even addressed some of her fears. And if you're not comfortable addressing some of her fears, well, then how comfortable are you really listening to her? Because aren't we just a collection of that when we engage with people, that sometimes we bring our fears, and in that moment there's an opportunity for that partnership, that relationship, that dynamic, for me to have my fears rested at ease, not because you're providing it to me. You're not providing me the solution per se, but you're providing me the mirror. You're maybe asking me, well, why am I afraid of this? Let's talk in a way that's going to help.
Yeah.
That be in that situation for a health, ways to advocate for yourself, but also strategic ways to have the conversation with the clinician. Right. There are ways that they can throw out something and make a suggestion, but a lot of times you have this fear, again, because you didn't go to med school and you're not a doctor, and Dr. Google didn't do enough for you to kind of feel like you could have this conversation. Simple strategies, but so that you can make an informed decision about your yeses, but also about your nos and what you're not comfortable with. You want to be informed. You want to just jump all in just because somebody said so, because the jump all in picture doesn't always have the best outcome.
How much of your profession is based off making an educated guess despite what the patient is saying?
How much of it just went out for a second. How
much of your profession or is based off making an educated guess despite what is visibly in front, or what we're hearing? Because as a patient, sometimes when I have been I felt like I just kind of was put to the side. I feel like, because I'm talking to a professional, I feel like this professional is making, in their mind, they're making an educated guess, right? based off me expressing my pain, and their educated guess is not equivalent to what I'm expressing. So that's why I asked, I said, how much of your profession, how much do you think your colleagues, not immediately within SPORA Health, but just on a grand scale, how much do you think people, clinicians base their next move on how they approach patients off of their educated guess?
So I would say this. I would say, medicine, when we say we're practicing medicine in a way, it's almost like a running joke that we are practicing the art of medicine. It is a science, but there is an art to it. So we can have all the foundations about, okay, this is hypertension. These are the hypertension medications available. You have these to choose from. The art in it is knowing that, okay, these classes of medications work better for Black people compared to other people, simply because of this other factor. The art is actually applying that you're going to take who's in front of you and say, I'm not just going to give them what I give everybody else who might be white. As far as my patient, this one Black patient, I am paying attention enough to know that this medication specifically will be better for this person, as opposed to someone else. That is the application. Even though we have all these medications, no one would really say, oh, you didn't give the Black person that one medication? Probably not. But that is where it comes in about how passionate are you about what you took the oath about, being a medical clinician, in an effort to do no harm and to really serve people. It's almost like, yes, I work, but I work for you. I work for you. And so it's really not that I'm the boss. You're the one kind of giving me everything for me to kind of make this project work for you. And so I think what is a factor in how people make their decision making has to do certainly with implicit bias, including people who look like you and who look like I. Implicit bias, we really can't all escape it, but we should all be making the effort to do the work to minimize how those things can leak over into your medical decision making, right, which is exactly how we can talk about a lot of these disparities, because you have a art bag full of tools, but your cookie cutter applying it may not work for a certain demographic, and you haven't really shifted from that. You haven't pivoted to find out what works for them. It might mean, and her visit is not 15 minutes like everyone else. Her visit is 30 minutes because there is enough of a history and enough of the statistic to show that Black women don't feel like they're being heard, don't feel like their questions and their concerns are really being addressed, and that you kind of were like, okay, 15 minutes is up, get out of here, as the result of lack of patient-provider connections. And again, when we go back to what does that look like at being a clinician in the healthcare space? I mean, Black people in obstetrics make up a very small percent. I want to say last I checked, it was around 7 or 8%, and then 5% kind of nationwide. That's really low when you're looking about, I mean, even if you just look at raw numbers, there's not every Black patient is going to have that opportunity to make this connection with me or right, another, which is why we focus on teaching you the tools, because I can't control the environment out there. I can't control someone else's implicit bias and systemic right, racism. I wish I could. But what I can do is give you tools about how to navigate this space.
Right. Is there allyship within the healthcare community amongst clinicians, amongst the community? Do you think that there is allyship where the different ethnicities, clinicians from different backgrounds, they are reaching out to learn about, or how can I have this patient, and we don't share the same background, but I want to help her. Is there any type of allyship when it comes to trying to provide better care for a patient that a specific clinician may not share the same background with?
It's a great question. It should happen.
Okay.
I don't know if it's limited just because of my own maybe experience. People who have allyship are people who look like you and I. We're most concerned about it because we are not only understand that deeply. And so amongst us, I feel like anytime I could meet somebody day one, and if we're at a PA conference somewhere or whatever, and you immediately connect. And when you talk about these things, it's always some back end effort within the organization that you're in for you to raise the awareness. But is it really our responsibility to raise the awareness? I mean, we're doing it. We're doing it because if not us, then who else is? But the question is
I think when it comes to raising the responsibility, I think that I feel that it's my responsibility to live in my passion and to to know that whatever space that I'm in, that the individuals that I'm in this space understand where I'm at. And in that, I'm educating. I'm also opening the door for discussion. But that's all I'm responsible for. I'm not necessarily responsible to walk you through a specific step. However, as an individual, I know that I am responsible to walk in my passion and to also create a space, create a space for me, right? And for others to educate, to send and receive information, but not necessarily, walk you through on how to, do certain things. Because essentially, I don't think that would be effective, but I feel like it's my duty to at least have, to educate, to have a space where someone could want to learn, not so much that they're falling on me to be the encyclopedia for everything, because that's not going to work.
You want that you're creating a space that if they want to put in the work, they also have a space to connect, to discuss, to learn, to grow, but they put in the work initially. And I'm, again, that's just my own limited experience. There are clearly people who do not look like you and I, who are making the efforts, who are doing the work. But to blanket say that across the board in the profession, I feel like for this disparity that still exists among Black birthing women or birthing women in general, I mean, it's not like in general pregnancy, mortality, morbidity is great either. And that's for just all women. So it's, and who's to take up that flag and say, listen, this has to stop. This is a first world country, develop, you have all these resources. How is it that somebody goes in to deliver a baby and dies? Now, there are a lot of things that could happen, but statistics are that, about 60% of those are preventable, 60%.
And being that you are a doula, do you have any programs or any sessions, or how does someone that's pregnant that will want to learn from you, or have a one-on-one session with you, or get more insight about, those stages and what you have to offer in that spectrum?
Well, again, that is exactly what we got going on over at SPORA Mamas. Okay, we have it's a total package. It's a comprehensive childbirth education class. We are among the lowest in general when it comes to childbirth education classes, being prepared about those body changes, but then also how to navigate labor, delivery, and the postpartum window. We have the lowest participation in general for childbirth education classes, and our part, not many of them are culturally competent or culturally aware. So we are really offering something like that at SPORA. We offer over 10 modules of this comprehensive childbirth education, where I'm leading this particular cohort that's active right now. And it's just going really well. The other component is that we have the one-to-one doula time. So for each client that is registered in the class, they have about 3 to 5 scheduled sessions with me to just, what is important to you? Not, something you may not be comfortable saying in the class, or just things as we drilled through each class, things that you discovered are important to you, and how to navigate and build that childbirth plan, or have that conversation with your village, or all the things that could possibly come up. We got that one-on-one time to discuss it. We also send them a maternal health kit, which are essentially preventative measure trackers, tools. It's a blood pressure cuff, it's a pulse oximeter. These are both vitals that they're OBGYN is tracking, but this gives the client their own opportunity to, one, have their vitals under their control.
Yeah.
They're checking at home. And when I encourage them that when you go to your doctors, because it's using our app, you have the SPORA app, all your vitals are logged right there, you cross-check. This is a great way to, in case this particular doctor, you didn't really have other choices, you went to them, they're not really listening to you, they're very dismissive of you. If they also dismissed a vital sign that might have been a really good indicator of, hey, we should intervene early, and they missed it, you've got it.
Right.
You've got it. Has it built to send you the alert to let you know, like, this is outside of the normal range.
Right. Well, that's awesome. You mentioned the one-to-one sessions, and I think sometimes when people think of doula, they think of it's only for women. How do you connect with the male partner in the doula process, and can they also participate?
Yes. So in the capacity that I'm with SPORA, I am a virtual doula now. So we are actually working through kind of having somewhat of like a crash course for maybe the partners, but they're all welcome to attend the sessions with their significant other. Prior to this, as a doula, certainly you encourage the partner to be there. And what you're talking to the partner about is slightly different from what you're talking to the female about. Right. Yes, he will be familiar with what a contraction looks like and how to time that. But I think it's important when you're talking to the partner, the person who's not pregnant, right. The kind of support and what that really looks like, the kind of support that she's going to need in the last couple of weeks, that when that fatigue really hits you like nobody's business, defining what roles look like, especially if you have a mindset of like traditional, like I do this, you do this, right. And being flexible to that, including with baby, that it cannot be all on the person who was pregnant to just be going through, what feels like months. I have a 4-year-old, and it felt like 2 or 3 years still of just, I don't get any sleep.
Right. Yeah.
Definitely want partner, not just buy-in, but kind of reminding them the purpose and the reason is because they love and they're here to support this person, and right. that the burden is a shared burden, because you also shared the experience to
make baby. Essentially.
Yeah, and that is life,
Yeah. You mentioned the SPORA Health app. So I want my listeners to kind of get some insight on tell us more about SPORA Health and the app and what it has to offer.
SPORA Health in general. So SPORA Mom Health. SPORA Health is a primary care virtual platform for Black people and people of color. This is where your providers have been trained on cultural competence, awareness, and as well as several other factors just built in to make sure that we're supporting the people who come to us. There is like a membership package that you could purchase. I think they are also working on having it to accept certain insurance. I believe there's a couple that they already do take. And as a member or a patient, you download the app, and built into that is options to track your vitals, to kind of talk with your SPORA Health doctor or your mid-level provider. If you see me, you have the option to chat right through there, go through things. It's all HIPAA compliant. Reminders, I can build you a healthcare plan. Say you really said you wanted to focus on to quit smoking. Awesome. Easy just for me to be like, just stop smoking tomorrow, right? Like, but right. That's not really being aware and sensitive to the fact, like, clearly not. So let's talk about how let's work with you about how that's going to work. What's ideal for you? And then let's build it up so that I can build that plan on the back. It sends it to your phone with reminders, with goals, where you're just with a touch of a button engaging, but also kind of having that visual to kind of stay focused on what you want to be able to report back to me in a couple of weeks. Right. So it's a great experience because it's affordable, and everybody should have access to good quality healthcare. Not because right. It's affordable means it's like, it's like, no, you have some great clinicians providing great services, and I just love it. I love being a part of it.
Well, as you're explaining it to me, it sounds like SPORA Health is a great virtual support system. You know,
Absolutely.
like a virtual health support system. It's a support system by me just listening. And I also took the time to go on the website to check out the social media and to see the branding and the goal. And it stood out to our team because it aligned, because the focus is to focus on African Americans. I see that that's primarily, but it's also, it's a variety of different things that you guys are focusing on. It's health. It's also adapting to the climate of things needing to be virtual. And
Yes.
that's one of the things that I think that's definitely a perk. As a life coach, I'm not a therapist, so I am a life coach, but I am excited to share this information with my clients. And, if you
Yes.
guys have therapists, I can always refer and so forth, and even with the doula service and so forth. So I'm very thankful that, that we had this conversation.
I am too. I really, again, I support everything that you're doing, because, there's so many options out there. There's so many things that are more trendy, sexier, have more likes. And in
Yeah.
a way, the road less traveled is the road. So you got it. I'm proud of you.
Oh, thank you.
Interested in Spora Health, they can go to the website, sporahealth.com, or the Spora Mamas website is specifically www.mamas.sporahealth. And I can send that to you offline so you can share it with all of your viewers and your readers. And
Yes. All right. Well, thank you so much. Was the Shut Up or Talk Up Wellness Health Talk for the community. We had the honor of speaking to Nicha Cumberbatch with Spora Health. And you guys, we want you guys to tune into Spora Health. It's a healthcare support system. You get the app, download it, sign up, check out their latest activities, incentives, and get in tune. Definitely get in tune. Thank you guys for tuning in.
come get your doctor's visit. Yes.
Yes.
Thank you.
Yes. Because staying healthy is wealthy.
Yes. Amen.
Amen. All right.